Here is a 360 view of the environment. Okay, so first of all, before we meet the client, first we have to check for the and verify the physician's order. So upon checking the MAR of my client, I saw that the patient's name is Dana Joy Puño. She is scheduled for a clinical breast assessment for her routine checkup, and it is upon checking the physician's order, it is ordered that it should be done in May 7, 2025, which is today. Okay? And now, after checking that, we can now proceed to gathering the equipments and the necessary materials for our procedure. So what we have here is the alcohol for our hand hygiene, our gloves, and I also have my notebook and pen for the documentation of my findings. Okay? So now we can proceed to meeting our client, introducing ourselves, and verifying their identity, and also proceeding to explain the procedure to the client. So, good day ma'am, my name is Chanel Cachele Angler, student nurse from Cavite State University, and now I would need to verify your identity. Also, could I have your wrist so I could check your wristband? Okay, so it says here that okay, so could you please state your name, your age, your birth date? Okay. And currently you're residing in room 317. And now I will be proceeding to explain the procedure to you, ma'am. So today you are scheduled for a breast assessment for your routine checkup, which is ordered by your physician. And this is essential since any abnormal findings within your breast area can actually indicate something about your health. Okay, so now I would also need to ask for your permission since this procedure requires a lot of contact with a private areas of yours, which is your breast area. And so, do I have your permission? Okay. And let me also ask a few things about before we proceed with our assessment. So let me just ask you if have you had any past surgeries for your breast? No? Okay. And what about family health illness of breast cancer? No? Okay. And lastly, do you have any history of using cigarettes? No? Or smoking? Okay, no. And what about drinking and drugs? No also. Okay, so now let me ask you to please put on a gown, and I will be providing you some privacy by closing the curtains and closing the door. Okay, and while we provide privacy to the client, let us now proceed to perform hand hygiene and observe other precautionary measures. So I will be donning gloves. And then and we will now be performing donning the gloves. Okay, so are you comfortable where you're sitting right now, ma'am? Okay. So now we can proceed to the assessment of your breast. Okay, so we will be starting with the inspection of the breast of our client. So first, we will be checking for the size and symmetry of the breast. So I could see that it is symmetrical in both sides. The size is also normal. And next, we will be checking for the color and texture of the breast of our client. So, okay, so the color of the breast is same all throughout the rest of the body color, which is light medium brown. And then the texture, so I did not see any sort of scaly regions or any inflammation or redness, infections, and any rashes. Okay? And then next we will be checking for any superficial venous pattern. So upon checking on both sides, there are no prominent veins that is seen within the breast region. Okay? And then next we will be checking for the dimpling and the retraction of the breast of the client. So ma'am, I would need you to please follow my orders. So first, I would need you to follow this pose and then flex your chest. Okay? So assuming that my client did that, okay, so I see that there are no retraction or dimpling. And next, I would need you to please follow this position and then flex your chest one more time. Okay, so it is moving equally in both sides and there are no retractions or dimpling. And lastly, I would need you to please do this position. Okay. Again, there are no retractions or dimpling. Okay? And after that, we will now be inspecting for the bilateral inspection of the areola of the client. So we will be checking for the size, color, shape, and texture. So the areola is the pigmented area along the breast region, and it is outside here, outside the nipple area. Okay, so I can see that the areola is light brown. It is quite circular. And as for the texture, there are no rashes to be noted, infections. It is not hairy. Okay, and okay, there are no rashes. There are also no scaly region. Okay, and after that, we can now proceed to the bilateral inspection of the nipples of the client. So we will be checking for the, again, size, color, shape, texture, and also the direction of the nipples of our client. So upon inspection, I can see that the nipples of the client is pointing upwards, which is a normal direction, and the nipples are also circular and it is dark brown. Okay, and I could not note any abnormal findings with its texture. There are no scaly regions. Yeah, and as for the size, it is circular, and it is small circular, and it is equal in both sides. Okay, after that, we can now proceed to the palpation of the breast of our client. So first, we will be checking for the texture, the tenderness, and also the elasticity of the breast of our client by doing the vertical motion. So we will be starting with a light palpation and then a deep palpation. So we will be doing this, then, so that we can cover the entire area of the breast region. So let me start. And then the other side. Okay, so upon checking, the patient reported no tenderness. The elasticity of the breast is normal. And as for the texture, I did not feel any sort of rashes, infection, redness, or inflammation, or any scaly region within the breast area. So now we will be checking for the temperature with the use of the dorsum part of our hands. Okay, so as for the temperature, the client is not too hot and not too cold, so it is in the warm temperature, which is normal. And then we can now proceed to the checking for the palpation for masses of the breast region of the client. So we will just be repeating the vertical palpation for our client. So we'll be checking for any masses. Again, ma'am, please tell me if there is pain when I touch right here. Then the other side too. Okay, so I did not feel any sort of masses from the breast of the client. However, if there is masses that is in our client, it is important to take note of its location, its size in centimeters, its mobility, consistency, and the tenderness of the mass. Okay, and next we will be starting to palpate the nipples of our client by gently compressing or pressing with the use of our thumb and index finger. And remember to put just a gentle pressure. So this is important to check for any fluid that may come out from the nipple of our client. So let's start it. Okay, the other side. Oh. So upon palpation of the nipples of the client, there is no fluid to take note of for this assessment. So next, let us move on to the checking of the mastectomy site of our client. However, since the client indicated earlier that she had no experience of past surgeries for the breast area, we will be skipping this procedure. However, if your client has some mastectomy site, it is important to take note of its the scarring right at the breast and axillae area, and also the remaining tissues that may be found at both areas. Okay, so that was the last step. So we will now be moving on to the axillae area. Okay, so first we will be inspecting for any rashes or infections at the axillary area. So ma'am, could you please raise your hand? Okay, and I will just be inspecting. Okay, and the other side now. Okay. So upon inspection, there is no rashes or infections that we have to be worried of. Okay, and now we will start to palpate the axillary lymph nodes of our client by having our one hand to hold the elbow so that the muscles of the client can relax and we can feel better the axillary lymph nodes. And then we will be palpating it with the use of these 3 finger pads on the other hand. So let us first get the lateral view, lateral aspect. Okay, and now the anterior aspect. Okay, and now the posterior aspect. Okay, and now let's turn to the other side. Again, the lateral aspect, the anterior aspect, and then the posterior aspect. Okay, after that, we will now be palpating the high end of the axillae, and then we will be moving downward to the rib region so that we can feel the central nodes, and then we will continue at the posterior nodes so that we can feel the posterior nodes. Okay, so let's start at the high end, down to the ribs to feel for the central nodes. Okay, then the other side. Down to the ribs, and then let's move on to the posterior aspect. Okay, Then the posterior aspect of the other side. Alright. So the patient reported no tenderness upon palpation on that. So now let's move on to the bimanual palpation of the anterior aspect of the lymph nodes of the axillary area. So we will be moving against the ribs. Okay, and now the other side. So again, the patient reported no tenderness when I palpated on this both sides. Okay, and now we will be performing the last step, which is to palpate the inner arm of our client. Okay, so let's start now. And then the other side. And before we proceed to the next steps, let us repeat the bimanual palpation for the anterior aspect. So it's important to remember that it is bimanual, so we have to use both hands. Okay, so the other side. And after this procedure, ma'am, we are now done. So you can now dress up in your clothing once again. And we will be removing these gloves. And then let's wash our hands. Let's perform hand hygiene. Okay, and now we can proceed to documenting the findings of the breast and axillae assessment of our client. So thank you for your great cooperation, ma'am. You can now proceed to go out, and we will be contacting you shortly about the physician's order. Thank you.